family, welcome to another beautiful edition of Annie Otto's vlog. If today's your first day watching me, you are welcome. If you're returning from, thank you so much for coming back. I really love and appreciate you. So guys, in today's edition, we are going to be zooming into men's health. Yes, do not forget to like, share and comment on my videos. There are some most important tests a guy needs to do when he hits the age of 40, although some of them should be ongoing before the age of 40. But when once a man hits the age of 40, he should be very intentional about this test. So at age 40, go and do your physical in details, and these are the tests that you must do at age 40. Cholesterol. So we know that cholesterol is a type of fat that stays in the arteries, and when they get bigger, they can clog the artery, block the artery, causing stroke or heart attack. So go to the doctor and do a simple blood test so that the doctor can know where your cholesterol level is and treat you accordingly. Number 2, colorectal cancer. The doctor needs to screen you for colorectal cancer. That means cancer of the intestine, cancer of the bowels. The doctor needs to check for that. So it is the second leading cause of death in the United States. That means it is the same in other countries, but the diagnosis is not as broad as it is in the United States. So the doctor will do a simple test that will give you a kit that you take home. You poop, you rub it on that kit and send it back to the lab, and they will test if there is blood in your stool. Another test is colonoscopy, which is done every 10 years if you are not at risk of colon cancer. Another one is flexible sigmoidoscopy. So this one is done every 5 years, and it's going to check your bowels and your rectum to make sure there's no trace of cancer or polyps. Another test is hepatitis. So we are specifically focusing on hepatitis because this can lead to liver dysfunction, liver disease. The hepatitis C can be spread by sharing infected needle from infected people. So that's why we need to be very careful not to share needles. People who use drug injection, people who do tattoo are at the highest risk of getting hepatitis C. Testing for hepatitis C is being done by simple blood test. Number 4, diabetes. So when you get to the doctor at age 40, make sure the doctor check what we call A1C, glycated hemoglobin. So the doctor will draw a simple blood, take it to the lab and check your A1C. The normal level or recommended level is less than 5.7%. You know, diabetes can lead to kidney failure, nerve damages, as well as eye problems, can lead to stroke. Another one is hormone health. Guys, you know, when you hit the age of 40, a lot of things take place, especially in your sexual department. So the doctor needs to check your testosterone level. When it's low, you're going to be experiencing a lot of erectile dysfunction, and when you are checking that department, the doctor needs to palpate your scrotum, you know, your testicles, to make sure there are no cysts and masses around your testicular areas. Okay, so again, the doctor needs to check your erectile function to make sure that that department is functioning very well. If you're experiencing any erectile dysfunction, you also need to discuss it with your doctor at that particular time. Another test of hormone the doctor needs to do is the thyroid. So if you have low thyroid, that can also lead to depression, lead to sluggishness, inappropriate weight gain, tiredness. So if you are experiencing any type of problem in that department, the doctor will also let you know what medications you can take to boost your thyroid level. Another one is prostate cancer test. So guys, the doctor will do a simple blood test to check your prostate specific antigen PSA level. So the number one have to be less than 4.0 nanogram per milliliter. That's normal PSA level. Again, this is to make sure that there's no trace of prostate cancer existing or is about to take place. Another one is blood pressure. I know we're supposed to be checking our blood pressure before the age 40, but make it intentional, effectively at age 40. So guys, you know, having high blood pressure is not a good thing to anybody's health. Increased blood pressure, which is hypertension, can lead to the risk to heart attack, stroke, kidney diseases, and heart failure. Make it intentional that your blood pressure is within normal limits. Weight gain. When you hit the age of 40, it's like they poured a bucket of weight on you. People gain weight uncontrollably, so that's why we need to work extra hard to maintain a normal body weight. So the doctor will check your weight. Are you obese? So guys, the doctor will measure your height and your weight, and then get your BMI, which is the body mass index. If your body mass index is between 18 to 25, you are normal. Above 25 to 30, you are overweight. Over 30 is obesity. You are obese. So the doctor will work with you if you are having abnormal weight. The doctor will tell you what to do, exercise, food to eat, and other things that will make you keep a normal body weight. Another one is lung cancer. Do you know that lung cancer is the leading cause of death worldwide? We need to be careful. If you are smoking anything, please quit, okay? If you are the type that lights up candles, mosquito coils, and pesticides, insecticides, petroleum fuel, and exhaust, and all the stuff, we need to be careful. All these things will lead to lung cancer. So the doctor will check to make sure that you don't have any trace of lung cancer by doing a test we call computed tomography, CT scan. Okay, so this will detect early sign of lung cancer. Another thing the doctor needs to check is abdominal aortic aneurysm. So aorta is a large vessel that carries blood from the heart to the abdomen. So at some point, this gets weak and becomes bulgy like a balloon. If care is not taken, this is going to burst and the person can die instantly. So even in the sophisticated world, it's very, very hard to have emergency surgery successfully to revive somebody who had abdominal aortic aneurysm. At age 40, make sure that the doctor checks your artery around the abdomen to make sure there's no bulging, there is no weakness, there is no balloon-like type of artery within that abdomen. So this is done by just simple ultrasound of the abdomen. Risk factor of this is smoking as well. So you see why we are hammering to stop smoking. STD test. Even when you would think that you are in a very safe sexual relationship, STD test is a must when you get at the age of 40, you know, to make sure you don't have any syphilis, any gonorrhea, any HIV. Directly or indirectly, you can't just specifically say what you have and what you don't have. So having a test done will keep you at the safer side of STD free. So STD is sexually transmitted diseases. Even when you think you don't have it, there's no way you should have it, but get the test done to completely be on the safer side. Vision. Even before the age 40, people will be experiencing vision issues. People might be genetic, while others is just aging process. So the doctor will make sure that your vision is still 20/20, that you don't have any vision problems, and you are not at risk of glaucoma. So guys, these are the 12 most important tests every man needs to do when he hits the age 40. Cholesterol level check, colorectal cancer check, hepatitis C check, diabetes check, hormone health check, prostate cancer check, blood pressure check, obesity check, lung cancer check, abdominal aortic aneurysm check, STD check, and vision health check. Alright guys, so I hope you have learned one or two things. As a guy, when you hit the age of 40, please make sure you take care of your health. Please share this with other guys. If you're a lady, share with any man that is related to you or is in your life. It's very, very important. Please do not forget to like, share, and comment on my videos. I'm your girl, Annie Otta. I love you guys. Please stay safe. Bye guys.